Well, I think government actually has a fairly important role to play. I think, in the most obvious sense, when you have real threats to people's safety, right? So, government still continues to have a role in upholding the law, protecting people's persons and property. And specifically within an epidemic kind of situation, I think there's an important role that the government can play in working with public health officials, working with researchers and epidemiologists in trying to assess the threat. And so gathering data, coordinating data collection, and then providing that information to the public in a variety of ways. And so one of the things that I think we want to look at is the role of the government as one stream of information by which people can make informed decisions for themselves and their families. I think there's also a role to be played in relief, in terms of tax relief and other kinds of financial relief for small businesses and individuals who are struggling, unemployment provisions, and so on. So I think that there's definitely very legitimate kinds of roles for government to play. I would say that, generally speaking, the sort of informational piece, as well as the ability to coordinate, particularly with other countries. So we're seeing, for example, the role that government can play in coordinating with China, for example, or Europe, in trying to coordinate their responses so that they can work together. I've actually been watching my own community respond to this in really kind of fascinating ways. There's been a huge neighborhood mobilization, especially in a lot of city neighborhoods. You have uh, pop-up food pantries opening up where people are collecting food from the community. This isn't food that's coming from any kind of centralized location. It's just neighbors and other folks dropping off food for these free pantries that then operate in these localities. You see Muslim organizations, for example, running food pantries that provide halal food. And so that's obviously a way in which people would be getting food that's more closely tailored to their specific needs, religious or otherwise. I've seen in the closure of libraries, little free libraries popping up all over the place. People have actually, in many city neighborhoods, converted their little free libraries to mini food pantries. So people just pop in and put food in there, and then people who need it can take food out. We go to our neighborhood little free libraries a couple times a week now just to stock up because our libraries are closed. And so you see people donating iPads and computers so that kids can continue online learning. We have a couple of mutual aid organizations in Rochester in particular, but I think this is pretty much the case nationwide, that use social media as a way to to connect neighbors with each other. And so someone will post and say, family of 6 in need of groceries, and someone else will say, what do you need? And then they'll say, let's find it. Another interesting sort of mutual aid response I've seen is just people posting on social media to let people know which stores have specific items. So when toilet paper was running low, people would say, the Target over here has toilet paper, but this particular grocery store is still sold out. So there's this kind of the use of civil society on the ground to help coordinate people's behavior, I think has been really, really fascinating. But I think you see this I'm seeing a lot of really hopeful and very interesting kinds of activity from civil society. Everything from, there's a culinary relief fund for restaurant workers that's funded by the restaurant industry. Companies have started giving out free bicycles to essential workers to help them get to their jobs, especially those who are in financial distress in a variety of ways. Our local children's hospital is providing free counseling and mental health assistance. There's nonprofits offering free legal assistance for people who are facing foreclosure and eviction, and helping people navigate the unemployment situation. Again, you have churches, synagogues, mosques setting up sewing drives to make masks. All of this is in socially distant form, which is one reason why I think that social media can be so helpful in a situation like this where people can't be together physically. What people are doing is using existing social media networks and their in-person social networks to try to coordinate their efforts. And so I'm seeing churches, synagogues, and mosques doing, again, food drives, mask drives, providing rides and things when it's safe to help the elderly, for example. Emergency daycare is being offered by various nonprofits. Our local Wi-Fi company is providing free internet to students right now. Even our local dental school is providing free urgent care for people who are in need of dental assistance. And then you get into just all of the sort of local responses. So people have been handing out neighborhood questionnaires, leaving them in their neighbors' doorsteps to just see if their neighbors do need anything, because you can't run around as easily knocking on people's doors now. Our town supervisor, and so this is sort of a local government response, but our town supervisor has taken the lead in shutting down some parks where people were not, in fact, socially distancing. So people were engaging in soccer practice and so on. But he was able to keep most parks open. And that was, again, he was able to create a kind of tailored response because he knows the community. He knows which parks are problem parks and which parks people are, in fact, using in a responsible way. And so we didn't need a sort of blanket kind of response. He simply was able to shut down one particular park and leave the rest open. And so I think that you see a combination of civil society alongside federalism, and you see this across the nation, which is mayors differing from governors who differ from the national government in terms of how they think the response should go. And a lot of that has to do with the fact that local needs are quite different from the sort of national, that we don't have a national kind of response to this, because some people live in very rural areas. They're already fairly socially isolated or physically isolated. And so the kinds of responses that you would need in some areas are quite different than you would need in others. And so I think we're seeing federalism have some really interesting kinds of reactions and interactions with civil society, broadly speaking. And then on the international level, you're seeing all sorts of interesting things. I mean, you have innovators in Italy rigging out ventilators, at least when patent law doesn't get in the way. You have academic researchers developing antibody tests. You have corporations working on vaccines. And so I think you see real innovation, meaningful innovation is happening, as well as the stuff that's happening on the local level of individuals making masks and handing them out. There's a woman in my town who just makes masks every night and leaves them for free on her front doorstep. And so there's a lot of other things like that going on too. One of the ones that I just saw today was actually that the Native American tribes, at least in some parts of the nation, are struggling right now. They're being particularly hard hit due to COVID, and are in need of water. So apparently, the Hopi tribe, and I think another one, I think it was Navajo, set up a GoFundMe to help bring in water supplies, and the people of Ireland apparently have responded with significant contributions. And part of that was a result of the assistance that those same Native American tribes provided during the Irish potato famine. So you see this civil society memory going back, in this case, 170 something years, where people remember the people who have helped them in the past. And so they're now flooding donations into these areas. And the hope is that they will be able to get the clean water that they need. And that, of course, is in the face of what is largely a governmental failure. Well, I think we've seen some really obvious failures in terms of efficiency, in terms of the government response. I mean, I would say probably the biggest failure in our current response is a lack of testing infrastructure. And some of that came from the fact that the government, in particular the CDC, from what I understand about the situation, attempted to sort of gain or create a kind of centralized testing infrastructure that they had control over. So rather than what we call a polycentric system, where you have multiple centers of testing occurring, and then those testing maybe feeding into, or those tests feeding into some sort of central kind of system, the CDC wanted total control over testing from the beginning. And so there were actually academic researchers on the West Coast who were developing COVID tests, and the CDC was saying, you can't use those. And what ended up happening is that the CDC developed their own test, but it was contaminated. And so that, from what I can tell, from what we know, set back testing at least a month in the United States. And so that was a huge, huge problem. So the efficiency piece, I think, is really obvious, right? So you have this problem of when you demand a central response to a situation like this, that response has a very good chance of being less efficient than would be the case if you left it to multiple different nodes of action. But the other piece of that is that if there is a failure at that one central node, then you lose everything, and that's what we saw in the case of the CDC. So we're just starting to ramp up testing, which is one of the reasons why we're having this serious economic cost, is that we can't test, we don't know who is infected. And so our situation is quite different from other countries like Germany that had a decent testing infrastructure from the beginning. So I think that's the efficiency piece. And by the way, from what I know about this, Germany's testing response was much more efficient than ours because they left it to private industry. So the government played a regulatory role, but the government didn't require that all of the testing capabilities be in the government hands, or that all of these be the kinds of powers that the government needed to hold on to. So Germany allowed a civil society polycentric response, and the US did not. And so they have testing and we do not. So that, I think, is the efficiency piece. At the morality piece, and I'm going to talk about how the two are obviously really closely connected to each other. The morality piece comes from the fact that in a civil society response, you have less coercion, or at least less physical coercion, and more ability to meet people where they actually exist. So I mentioned, for example, Muslim food pantries are able to provide people with halal food, whereas a sort of government mandated centralized response might not be able to do that. So on the moral perspective, civil society provides people with more of what they actually need and what they actually want. At the same time, we see efficiency isn't just good for its own sake. There's a real moral component to a lack of efficiency. And so I think that's what we're seeing in the United States. The fact that we didn't have testing, the fact that our rollout of testing was so limited, means that the only option we had was to lock down, because we couldn't test people. We couldn't figure out who was actually a danger, and we couldn't do the kind of quarantining that countries can do if they, in fact, have decent testing. And so the result of that is, of course, that we have tens of thousands of people dying who probably wouldn't have to die otherwise. And we have just enormous damage to the economy. And that's damage not just in the sense of like Wall Street, it's damage to local businesses. It's damage to people's futures and retirements and people's educations. And so the lack of efficiency has enormous moral implications for how we come out of this situation. Do we come out as a stronger community, or do we come out really with just enormous human costs? And so I think that the link between the efficiency and the morality argument, I think, needs to be closely discussed. One benefit to a civil society response in a situation like a pandemic is that it's a little bit more flexible and requires less coercion than a blanket sort of government response would. So if you take, for example, mask wearing, you could enforce that with police officers and have them sort of running around communities. That would be very expensive. It would also probably involve violence of some kind. It would also put police at risk because they would be interacting with people who might be infected. And so that kind of government response is really sort of the last response you want, because it's expensive and it requires this physical coercion. What tends to work much better is just shame, and social shame and social pressure can be really important in instituting a norm or an expectation that when people are out in public, they will be wearing masks. And it's important to notice that the government can, of course, play into that norm. So Cuomo, in his press conference last week in New York, said that he wasn't going to enforce masks with coercion, although he later actually changed that position. But he was going to rely on people in their own communities to sort of enforce this with this social praise and blame. And at least in my community, I think we saw an immediate reaction to that. So if the evidence suggests that we should be wearing masks, we should all be wearing masks. So I think that there's an element to which the the civil society piece can be more moral because it's more flexible and requires less physical coercion for everybody involved.